Hello. I would like to share my screen and talk about the University Library's website. As you can see, we offer many services and also different ways to contact the librarians. If you click here where it says About, and you scroll down, you have the link to the Health Sciences Library. But before that, I would like to talk about other services. For example, the research and instructional services, and the option to schedule a research appointment. You have a menu where you can select a location. I would suggest that you choose online, and we have a list of very talented librarians. If you select my name, you will find the times that I have available to meet with you. If these times don't work for you, please contact me. You can send me an email and we can make special arrangements. Before we continue, I wanted to talk about this area here where we search. This is called the Discovery Service. The Discovery Service combines different databases, except PubMed and others. CNAL and other health sciences databases are included here. This would be a first step when you are exploring a topic. If you want to be more specific, you can use the databases specifically, going directly to those titles. I will show you how to do that. So one of my examples is diabetes. As you can see, the system provides related terms, and it's up to you. It's your decision if you want to use them or not, depending on your topic. If you click on diabetes type 2, you should add other keywords because this is a broad term. And once again, we have other related terms like treatment or intervention. Let's leave it like that for now. We also want to know about prevention. And databases have, like I mentioned before, different filters or limits. One of the most important is the date. We want recent documents, so let's see what happens here. If we include 2 years, peer-reviewed is an indicator of quality. It means that a board or group of experts approved the content of this article or document before it was published. We have the limit of full text, but I wouldn't recommend it because you don't want to exclude any important content for your research, especially when we have a service for you that is called interlibrary loan. I will talk about it later. So let's search. Like I mentioned, this is a very studied topic, and this is a big number. So what should we do? We have a menu, and we can use our keywords in our title. Keywords are important, but there are words that you can find anywhere. The title, the abstract, sometimes even in the article content. So you want to use subject terms. Subject terms are those topics applied by the editorial board, and they relate to the article's content. Let's see what happens. You see how we have less, but still a big number. We have many options. If we scroll down, we can add more filters. We want academic, journals. These are international databases. They include research from all over the world. So maybe we want to limit our research to English language. If we scroll down, we also have a geography. limit. And maybe, let's say we want to study what's happening in Europe. And you have 67. This is a number that you can review easily. But you also have the option to click on the plus sign and add more keywords. Let's say diet. And we have 57. So let's review. If you want to see the abstract, you have to click on the title. And you have relevant information, including the authors, publication type, mesh terms. These are the subjects I mentioned. This option provides more words to keep searching. Your abstract, references. You can send this to your email, save it, or if you click on Cite, we have this tool that provides references in different formats. APA is one of the most important. So here we have always double check. If you don't find the full text, you have the option to request an interlibrary loan. In this case, we have it. We have Wiley, and this is the PDF. Some of us prefer the PDF. Let's go back and see our result list. Let's say that you want to read this one and this one. Please notice how the color of the folder changes. Now you have your folder. I would recommend that you open an account with EBSCO so you can save those searches. Or you can continue with Google. This is what I do. Here's the full text. And let's go back. If you forget what you just did, you can always click on search history and you go back to those combinations, limiters, and your results. You can also combine different searches, clicking here. Or you can retrieve alerts on different topics. Always remember that if you have questions about these databases, you can always contact your librarians. So let's go back step by step to the University Library's website. And if you scroll down, you have the Health Sciences Library. I'm going to send you these links. But let's say that you want to search here and use CINAHL Complete. CINAHL is one of the most important databases for nursing. And if we use the same keywords, diabetes, let's say type 2, and we said prevention and therapy. Remember that if you scroll down, you have your limits. English language, and scholarly peer review. Let's see what we have here. This is a big number. So once again, we want to select. And these are options. You can always go back and change this. Instead of an abstract, use the subject. Subject is more focused because it's a topic assigned by experts. So we have 56. and we go through the same process. You can also change the date here, and remember the other filters like geography, gender, age, language, publication source, and others. If we go back to the University Libraries of Memphis, you can click on research guides. We have a list of diverse research guides. I know some of you ask about citation resources. We have a list of different resources. Here's APA. Also, we have a new module on Canvas that is very useful when you're going to use APA. You can talk to a librarian. You can chat with a librarian here. The chat is online. If you want to know the hours of the different libraries, you need to check here. Remember that you can also reserve a space if you need a study room. You have all the locations here. And there's information about interlibrary loan. If we go back to the Health Sciences Library, we have PubMed. PubMed is a database or a retrieval system from the National Library of Medicine, which is the most important library of medicine in the world, and is here in the United States in Bethesda. You can type your keywords. This is one of the strategies that you can use when you search PubMed, but you can also search using the medical subject headings. Oh, I'm sorry. Diabetes, prevention, and we said therapy. PubMed also has a list of filters, and we had already established some of them. I had marked from a previous search that I wanted 1-year publication, humans, English, female, and adult. If you want to see the abstract, you have the display options here. And the abstract always provides more information to make you make an informed decision. This article, for example, was cited by 2 other authors or group of authors, which is good. It's an indicator of quality. It's also an option to keep researching on your topic. And you can select those articles that are going to be effective for your research. Remember, always use PubMed through the University Library's website. We have our logo here. That means that we have a subscription. But PubMed also have a free full text archive. Remember to scroll down. You'll have more information about these studies, keywords, comments, citations. And if you click, for example, on any of this, comments, you can get the article or the abstract. You can save it, you can send it to your email, you can send everything to your clipboard. That means that you're going to have that list available for a while. But I would suggest, once again, that you save your results, that you send them to your email, and that you contact your librarian if you have any questions. When we go back to the university libraries, especially the science library, we have a research guide with different databases that you can explore and that are very useful for nursing students. Scopus is another one, up to date. So I would invite you to please review all those links, practice your searches, and contact your librarian if you have any questions. Thank you very much.